Medicare For All is a central part of congressional candidate Nina Turner's policy agenda. In a recent, pretty emotional campaign video, Turner said that when she fights for Medicare For All, she's fighting for working class people and her mama. Let's take a look.
Something that continues to haunt me to this day is my mother dying at the young age of 42 years old. No insurance, no money in the bank. So when I fight for Medicare For All, I'm fighting for my mama who's not here and working class people who need to have health care as a right, not a privilege. The poor, the working poor, and the barely middle class should live a good life. Wealth should not dictate whether or not you have access to health care. I'm Nina Turner, and I approve this message.
Joining us now to discuss is former National Press Secretary for the Bernie Sanders presidential campaign and co-host of the Bad Faith podcast, Briahna Joy Gray. Welcome back, Briahna.
It's good to be here.
Thanks so much for joining us. And, that ad actually kind of reminds me of one that went super viral just a few years back from Randy Bryce's campaign, talking about Medicare for All in these very emotional, personal terms. And I know that on the left, there is a very strong belief that when sort of described to people in a humane and accurate way, Medicare for All is really, really popular. I know that that's something that you believe. Do you think this ad in particular hits all of those notes and is something that does actually really resonate with working people who may have concerns about sort of the costs and the shifts in what coverage would look like, but see something like this and say, yeah, that's what we need?
Well, Emily, here's the great thing about Medicare for All. It's not just my perception that folks on the left are very enthusiastic about it. Poll after poll after polls demonstrate that both independents and even almost 50% of Republicans are supportive of Medicare for All. Not to mention, to your point, 88% of Democrats. What we learned throughout the Bernie campaign was that a lot of Americans had been, frankly, keeping their healthcare woes private. The average American family of four is paying upwards of $1,500 a month in premiums. And that's not coverage. That's just insurance guarding against the chance that someone gets sick, at which point you still have to meet your deductibles, and throughout which you're also paying for copays. That's an experience that no American, except for the very affluent, is able to avoid. And when Bernie started talking about those issues and having town halls where people came forward and talked about how degrading and emotional it was to be having to deal with these grievous health concerns of their loved ones, to be looking at their parents on their deathbed, and to be preoccupied with how they were going to pay for care, I think a lot of people started to open up and talk about what had been a kind of shameful private experience before, and we realized that we're living with a collective problem that could also be solved collectively.
I have a quick follow-up on that point, because what this ad gets at, and when we think back to the Bryce campaign and other campaigns, and what we said in the opening, that this is really a cornerstone of the Nina Turner campaign, what that gets at is where this ranks as a priority. It's not just sort of about the palatability of Medicare for All, which, as Briahna mentions, is popular in polling, on a bipartisan basis. You can find even support among a good chunk of Republicans for it. The question is, where does this rank on the priority list for voters? So even if it's popular or something they can get behind, why run on it? Is that speaking to a sort of inclination to say this is something this is at the top of the list? This is something that people will go to the polls and vote on when it comes to selecting a candidate?
So first of all, I would say that the priorities for all Americans across the board tend to be pretty stagnant over time. They care about the economy, they care about education, they care about public safety, and they care about healthcare. So I think it's always smart to talk about healthcare, especially since it is this enormous ethical issue that weighs on people, and that it really is a life or death issue. But I would also point out that something that Republicans are pretty good at that sometimes Democrats forget is that you can start to affect people's priorities by how you message. And my point about the Bernie campaign earlier was that a lot of folks inside really struggled with their healthcare concerns, but didn't really understand that there was a political solution to it until Bernie started talking about it, and until they heard other people who shared their concerns at these town halls. At that point, they felt like they were empowered to start talking about it more and prioritizing it politically in a way that they might not have done before. And so I think, especially coming out of the COVID pandemic, where 15 million Americans lost their health insurance because we have this really ridiculous healthcare system where your ability to get coverage is linked to your ability to stay employed. So when you're in your moment of crisis is exactly when you lose your health care. When people recognized how much stress was involved in getting care around the fallout effects of COVID COVID-19 and began to think more critically about the kind of system that we've set up for ourselves, I think it's really smart to go ahead and continue to beat that drum and not let this moment, this Overton window shift where folks are a lot more concerned with how to make broad systemic changes that prevent us from getting in that kind of stressful situation again. I think it's really smart of Senator Turner to exploit that.
I agree. And I just, to what you said about the issues about healthcare being very personal in some ways prior to Bernie actually putting them out there in the public square to discuss, and the ad that you brought up, the Randy Bryce ad, and what Nina does and her team does really, really well here, and after making thousands of ads in my life, is really key when you're talking about issues. It's not talking about issues. It's why should I believe you about these issues? And Nina specifically talks not just about working people, which is a broad generalized term. She talks about her mother's experience with no insurance and no health care, and that she's no longer here. And I think that's what makes it really effective in this particular campaign. I think it's what made it effective in Bernie's campaign, because he'd been there forever. He'd always been there. And I think ultimately, like you said, what changed the kind of discourse around this.
And look at this also. When I mentioned earlier that Republicans are really good at kind of setting people's priorities, we're right now in a moment where the number one Republican priority, if you were to turn on the TV and just check out what folks are talking about, are these bizarro kind of culture war issues, critical race theory, whether or not Mr. Potato Head is one gender or another. Like it's this
or
kind of absurdity, right? and they're good at it, right? They're good at distracting Americans of all political stripes, including conservatives, who I got to tell you are also struggling with healthcare concerns, are also struggling with the pandemic, are also struggling in the exact same ways that their compatriots across the aisle are struggling from thinking about those kinds of issues and instead prioritizing culture war issues that have absolutely nothing to do with how they're going to live their lives, how they're going to make sure their kids have an education, how they're going to be able to afford health care or keep a roof over their heads. And I think that sometimes Democrats need to not be so poll tested, although the polls are on our side on this one, not be so wedded to poll testing and instead have confidence that the ideas they're promoting are going to change people's lives. And if you enact them and people feel and experience them, you're going to be able to avoid some of the negative political consequences that typically follow winning a majority, winning the White House, which is typically you lose the House and the Senate. The only president who broke that trend was FDR. And I would argue that it's because he was actually able to very quickly enact policies that people could feel in their homes. Therefore, they decided, oh, this is a party I want to stick with. This is a team I want to stick with, and continue to vote for Democrats through the midterms and, frankly, until the man died.
I couldn't agree more, Briahna. If I have to hear quality, affordable health care as a term one more time in life and nobody actually knows what that means, I swear that, I'll never watch or make another ad again. Thank you so much, Briahna. We'll have more Rising for you right after this.